The number one injury for admissions at Christiana Care are falls. I'm Larry Menti. Welcome back to the Delaware Way. So how do you prevent falls, and they must be particularly worrisome this time of year? To talk more about that is Dr. Kevin Bradley, Associate Medical Director of the Trauma Program at Christiana Care, and Nurse Kathy Boyer, who is the Injury Prevention Coordinator for the Trauma Program. Thank you both for being here. Doctor, let me start with you. When we talk about falls, I know falls can inflict everybody, if that's the right word, but for the elderly, I would imagine this is a particular concern.
It is a particular concern because we're seeing a tremendous rise in the number of falls in the elderly population. And the reason for those falls are a multitude. As we all age, our situational awareness does get impaired, our vision, our hearing, and knowing our whereabouts. We are more prone to fall because of problems with mobility and balance. And then there are environmental hazards at play, which we all know even today on a wet day outside that could be very much at play. What we are seeing in terms of a population health and just looking at injured patients, a subset of that being elderly, we are seeing our patients live longer, and as a result being more active, we therefore are seeing more falls within that population.
Why is this particularly a particular concern for the elderly? Because the bones are more brittle, or because
every system in your body changes as you get older? There are changes in your eyesight, and yes, your bones are getting more brittle. It's very concerning because that causes more falls. As your body changes, you're more likely to fall. You're likely to be on medications, and medications can increase your chances of falling. And when a person has a fall, if they're older, they are not going to recover as well.
I told you right before we came on that I remember my grandmother falling. I happened to be in the house, and she said right then when she fell, she felt and she thought she broke her hip, and she said, "My life's over." There
is an increased risk for the older population. We have gotten better with our medical advances, that's very true, but we don't want people to fall, and falls are very preventable. We're very concerned about people who are on any blood thinning types of medications, and when they have a fall, that can increases their chances of bleeding because they're on blood thinners. So we have a lot of concern about our patients who are on blood thinners as well.
There's a number of medications that you could be on that you are on, for instance, for blood pressure management, that if you are not adequately hydrated, could result in dizziness that may lead to a fall. But the blood thinning medications are a big concern in the community, and I'm not trying to create overwhelming concern because there are certain clear-cut indications for blood thinning medications. But it is something to be considered when you're talking about a risk-benefit analysis for, is somebody at risk for falling, and should they be on a blood thinner? Because the blood thinner in and of itself makes injuries more profound.
But obviously, when you prescribe a blood thinner, you go through this, you tell them this. It shouldn't be of a surprise to them.
Absolutely. All of the medical providers are well trained to have a good risk-benefit discussion with the patient, and should also include a discussion with the family members.
Can we prevent falls?
There are many things we can do. There are four main things. Staying active is the most important thing, and some people have restrictions, but you talk to your doctor about your restrictions, and exercise is the most important thing.
See, to me that seems like it's conflicting information, that you're saying be active and the activity will cause a fall.
No, activities don't have to cause falls. Activities strengthen your body and keep you more mobile. When people are less mobile, they're more weaker and they're more likely to fall. Once a person has a fall and they develop a fear of falling, then they are more likely to fall again because they restrict their activity. The last thing you want to do is restrict your activity. You want to be active within whatever restrictions your physician may give you if you have restrictions. But really, maintaining your activity is very important as we get older. And doing an environmental safety check, and that could be everything from making sure that your shoes have good grip on them, making sure you keep things in easy reach so you're not reaching. Reaching causes a lot of falls, and just how you get up from a sitting position or a lying position, taking your time, that can prevent many falls.
You know, Doctor, it's fascinating what she said about the fear of falling can actually cause falling, because I know so many people that have a certain age that live in deathly fear of falling down, like I've told you the story about my grandmother. How do you overcome that?
It's really about Kathy's efforts in injury prevention and getting the word out to the community about safe practices with respect to balance and controlling for environmental hazards that are in the way. Reviewing your medication list with your primary care doctor. Do you need to be on the blood thinning medication, for instance?
We do a lot of education in the community. I go out to community groups, senior groups, civic associations, and we talk about ways to prevent falls, and one of the big things is maintain your activity. And it's hard to do that, especially after a fall, but being active is the most important thing that you can do.
Well, Dr. Kathy, thank you so much both for being here. Dr. Kevin Bradley, Associate Medical Director of the Trauma Program at Christiana Care, and also Nurse Kathy Boyer, Injury Prevention Coordinator for the Trauma Program. That was great information. When we come back, our friends from the Brandywine Zoo are here once again. And of course, they have a special guest. That's when the Delaware Way continues.